Having doubts about taking the COVID-19 vaccine with theories and speculations on what taking the jab might do to you? Let's listen to Dr. Diana Babbo from the River State Primary Health Care Management Board tell us why it is important to get vaccinated.
Okay, good morning. My name is Dr. Babbo Diana. I'm currently the acting state health educator with the Primary Health Care Management Board, River State Primary Health Care Management Board. Why do I think that COVID-19 vaccination is important? Vaccinations are important to give protection as regards certain illnesses. Generally, we give vaccinations across all ages. Children, vaccinations include not COVID-19 now. We give vaccinations across all ages to confer protection against certain diseases. In this case, it's COVID-19 virus, COVID-19 disease. So the COVID-19 vaccine is aimed at conferring some protection against the infection and the disease. So I think that the public should be interested to get their COVID-19 vaccines generally. Since the onset of the vaccines, we've heard a lot of stories online, on radio, on paper. We've heard a lot of stories. Some people say the vaccines, when you take the vaccine, it will kill you in 2 years. Some people have said you take the vaccine, you will stop performing as a man. Some say you take the vaccine, you will stop menstruating as a woman. You cannot take in. There are so many stories. There are those that have said you take the vaccine, it has a chip inside, and then you begin to conduct electricity and begin to light bulbs. Man, the issue is there will be stories surrounding all these things because some persons want to propagate conspiracies about the vaccine so that people won't take the vaccine. And in able to debunk some of this misinformation and myths, we will say follow the science of vaccines generally. Vaccines have always existed for disease and illness. Like I said, cutting across all ages, we've been giving vaccine, BCG vaccine, measles vaccines, HPV vaccine, OPV vaccine. There are so many vaccines that we give, smallpox, chickenpox. We give a lot of vaccines to our children and to some adolescent teenage groups. So why this particular one is surrounded by a lot of stories is it's worrisome to us because it's important that we key into it. We saw when the virus came, we saw the amount of deaths we had in some places like Italy. We saw them in masses. They had nowhere to lay dead bodies. There are some countries in the US that their capacity to hospitalize patients were overwhelmed. We saw their healthcare system broken. Some African countries also had that challenge. When we see that extent of overwhelming stress on healthcare, and we know in our part of the world as Africans, we don't particularly have a strengthened healthcare system. We were lucky enough not to be among those that were badly hit when the first wave, second wave, and third wave came. And we started bringing out protection measures. Wash your hands, wear masks, stay a safe distance between individuals, don't go to crowded places. We brought out such measures. And we saw that those things were not actually working per se, because people were not believing the stories around why they should wear a mask, why should we wash our hands, why should we stay up, why should we not go for why should we not go to churches, why should we not go to our gatherings, why should we not go to celebrations. They didn't see the reason for all that because we were lucky in this side of the world. But should we continue to count on luck? Now there is a more not permanent, there is a more effective means to protect yourself, which is the vaccines. And the vaccines have been there. They have a template before now for coronavirus vaccines. COVID-19 is not the first coronavirus. Like I keep saying, this virus has existed medically since long ago. We've had SARS, we've had the MERS, we've had the flu, and there's a template already in place for coronavirus vaccines. This one is just a new variant, and they keyed into that template to devise this vaccine. So let's follow the science, like I said. Let's follow the science and forget the myths. It's a pity that we believe in the stories, but I think as time goes on, we begin to understand how vaccines work. We begin to understand that it doesn't make any logical physics sense that I put a vaccine in my body and I begin to light a bulb or become an electromagnetic device. We begin to see that it doesn't make much sense that someone will say, I take a vaccine and I become impotent. Have you proven it? Science proves things. Can we prove these things before we begin to share it and then cause an unnecessary panic in the public? So I would tell your friend who asks you why and then try to discourage you. If you are better informed, follow the science of vaccination and vaccines. These vaccines are safe. We've seen that they are effective to confer some kind of protection against the disease. So let's key into it. Let's key into it. Thank you. Okay, let's go to measles that I mentioned. Now, we give a child measles vaccine at 9 months. In some climes, they give at 6 months. But we here, following the EPI schedule, we give at 9 months. We give again at 1 year and 3 months. That's a booster. And then when we find that there's an outbreak of measles in some places in the country, we now run a campaign to give booster doses of measles. Measles is a virus, actually. Most of these viral illnesses, they mutate or they change their form, so to say. So we as science have to keep up. We need a booster because right now in the country, and I think internationally, we have not achieved what we call the herd immunity, which is a community protection. What do I mean by community protection? As much as 80 to 90% of population in that community have been vaccinated or have had the illness and recovered, and so have a natural immunity. So now the community has some form of immunity to that particular illness. And when a variant comes in, it cannot break through to the community and cause as much havoc as we saw when we had COVID-19 the first time. So the boosters are necessary because we've not had herd immunity, community immunity. We've not had that. And so we need to giving the people that took an added advantage. A booster means it's kind of to it lays on the foundation. It's like a building. You put the first block, the second block. You keep laying on foundation because you want to prolong the protection that you gave the individual through that first vaccine. So for the COVID-19 vaccines, there are primary doses for AstraZeneca, Moderna, Johnson & Johnson. The primary doses are 2. For Johnson & Johnson is 1, AstraZeneca and Moderna is 2. After the primary dosing, we require to take a booster after some time because our immunity begins to drop. That's why we need the booster. Our immunity begins to drop. We've not achieved community immunity, so we need to boost to those that have been immunized or infected and got a natural immunity. We need to boost their immunity by giving that booster doses. So that's the need for the booster. Thank you. Okay, I like the way you say prioritizing their health. We keep hearing this hashtag, take responsibility for your health. The truth is the vaccines are free. But if you have COVID-19 infection, you go to hospital, your charge is not free. You are going to pay for it. And we want to see a situation where let's focus on, before now we were focusing on other illnesses, bed spaces were available for those that had malaria or that had hypertension, heart diseases, diabetes. You know, there are some serious things that medicine, that we should pay attention more to. But with the onset of COVID-19 and the waves that we've had, the healthcare system has been so stressed. We are not paying attention to these other things again. So if we take responsibility for our health, do the right things, the initial protection of washing your hands, wearing a mask, staying a safe distance between people, avoiding gatherings, and being vaccinated. Once we do this, we will reduce our hospitalization rates from COVID-19 infection and the disease. We will also reduce death rates from COVID-19 infection and disease, and then we can focus more on other things and spend energy on those things. So my advice is, let's key into it. The confidence of the public is poor, but with time, as we keep talking about it, as we keep sensitizing about it, we know that people are aware. They have heard about COVID-19, they've heard about the vaccines. Their problem is the confidence in the government or the people bringing the vaccines. But please have confidence that we are giving you what will not harm you, what will not kill you, what will not turn into a magnetic device. We are giving you what will protect you against a disease that is ongoing. It's evolving. We don't know where it's heading to. But we are giving you something that will protect you against this COVID-19 virus and disease. So take responsibility for your health is my advice to everyone listening to me currently. Let's key into what the government has. Like I said, the vaccines are free. Your bed stay in hospital, the time you spend, the stress on your family, that's not free. So don't get to that point. Thank you.